Let's talk about the most effective and least expensive mouthwash. And what we're talking about is sodium hypochlorite, which is the active ingredient in household bleach. Sodium hypochlorite has been used to render contaminated water potable for many years. And in a post made on the website of the Center for Disease Control in April of 2009, they suggested that you use 1/4 teaspoon to a gallon of contaminated water, and in doing that, you would render it drinkable. I was introduced to sodium hypochlorite as an oral rinse by Dr. Jorgen Slotz when we were attending a conference together in Mexico City in the early 1990s. Sodium hypochlorite 0.05 is the active ingredient in household bleach. Dr. Slotz advocated 1 teaspoon to 8 ounces of water and suggested that you use plain unscented sodium hypochlorite. And here's a reference on a publication from Dr. Slotz on the use of sodium hypochlorite as a oral rinse. Whereas Slotz advocated using this solution in the treatment of periodontal disease, and remember he recommended 1 teaspoon to 8 ounces of water, there's a modification that I personally use in my own mouth to prevent halitosis or malodor. A much weaker solution, 1 teaspoon to 32 ounces of water, and this is a quart. So you can see it's markedly diluted, but is highly effective when you also use a tongue scraper to scrape the posterior third of the tongue. The solution can also be used following periodontal surgery where there is not complete pocket elimination and there are residual pockets. And in my opinion, you can convert a pocket into a periodontal defect, and my philosophy and thoughts on this can be found by looking at this video on the web textbook, the difference between a periodontal pocket and a periodontal defect. Practical considerations. When using a water jet to treat pockets or residual periodontal defects, for a greater volume, I would suggest that you mix 4 teaspoons to a gallon of water. This will make the solution last longer. Place about 4 to 6 ounces in the reservoir of the water jet. Care should be taken when using the water jet, for the splatter created by the water will bleach clothing. Now let's talk about how the solution is mixed. Always use a measuring spoon to accurately determine the amount of sodium hypochlorite used to make the oral rinse. Here we see a teaspoon on the top and a tablespoon on the bottom, and you do not want to mix it too strong, for more is not better. Using a quart jar and your teaspoon, these are the only 2 things that you need. Before using this solution, please watch the video, The Importance of Cleaning Your Tongue, for the problem with malodor is not on the anterior part of the tongue, but the posterior 1/3 of the tongue. For the sulfur-forming bacteria giving off the aroma or odor of rotten eggs is caused by these bacteria. Cannot be brushed off, but look at the video, The Importance of Cleaning Your Tongue. Learn how to do that. How do you use the solution? Use 1 ounce of the solution and swish between the teeth after brushing and interdental cleansing using an interdental brush or floss or whatever you use. Gargle to kill the bacteria and viral pathogens on the posterior third of the tongue where those sulfur-forming bacteria associated with malodor are found. Next, use the tongue scraper to work the solution into the posterior part of the tongue. And finally, rinse vigorously with plain water and spit that out. How effective is the water jet in removing plaque? Let's talk about plaque. First of all, we have the acquired pellicle, which is a thin protein-containing film derived from salivary glycoproteins. And it's found that this begins to reform 30 seconds after brushing and removing that pellicle. So bacterial plaque, when the bacteria attach to the acquired pellicle, this becomes bacterial plaque. This article, dating back to the 1980s, needs to be revisited when we think about the use of the water jet. because they found that moderate hydraulic forces produced by the dental water jet can significantly remove the biofilm. And if we remove the biofilm and decontaminate this with sodium hypochlorite, I think we can see that this is much more effective. And perhaps sodium hypochlorite used in the water pick by the patient who refuses to floss might be very effective. So here we see a picture of the water jet, and this can be purchased anywhere from about $30 to $60. By using the water irrigator on residual pockets, the solution is forced deeper subgingially. By mixing a gallon, you may only have to mix it occasionally rather than every day. Does the solution degrade over a period of time? Discard the solution and make a new solution every 2 to 3 weeks. Disclaimer: this information is being provided for educational purposes only, and the solution should only be used at your own risk. This is not a prescription. As said earlier, the solution should only be used at your own risk. Under no circumstances should it be swallowed. Children should not be using this solution because they may inadvertently swallow some of it. Expectant mothers or women considering becoming pregnant should not use the solution, as the impact on the developing fetus is not known. What are the side effects of ingesting sodium hypochlorite? Drinking bleach can cause effects that range from mild to serious, depending on the amount ingested. Medline Plus states that consuming diluted bleach or sodium hypochlorite may lead to mild stomach irritation. Ingesting larger amounts can lead to gagging, pain in the throat or the mouth, burning in the esophagus, chest pains, low blood pressure, slowing of the heart rate, delirium, coma, shock, vomiting, and stomach or pain in the abdomen. In closing, as I said earlier, I've started using this very, very weak solution on a daily basis. And quite frankly, it has changed the flora on the posterior third of my tongue over a period of time. Malodor is no longer a problem, and the feeling of cleanliness that I have in my mouth is absolutely remarkable. So I would suggest that you take the Miller Challenge. Try this protocol for a month, see how it works in your own mouth, and in my opinion, you will stick with it.